You know that feeling, right? You give your dog or cat their meds, maybe something they've had tons of times, no problem.
Yeah.
And then maybe later you see this weird rash, or their skin just looks well off.
That little worry spike.
Exactly. That's what we're getting into today. Cutaneous drug eruptions in our pets.
We're going to unpack it, look at what the medical literature says about, how these reactions look, what might cause them.
And how vets figure it all out.
Yeah.
The goal here isn't to scare anyone, okay?
Not at all. It's about awareness, giving you the knowledge so you know what could happen and what's involved if it does.
Right. So what's kind of fascinating right away is just how different these reactions can look.
Oh, absolutely. It's a huge spectrum. Sometimes they're so mild you might barely notice.
Or miss them completely.
Or miss them completely. And other times, well, they can become really serious, even life-threatening. So spotting signs early is, super important.
Okay, definitely. So let's jump right in. What are some of those first things, those initial clues we might see?
Often, the very first sign is just that your pet is suddenly really, really itchy. That's pruritus.
Pruritus, right. Got it.
And you might see just general signs of skin inflammation, things like macular rashes. Those are the flat, discolored spots, or papular rashes, which are like little raised bumps.
Okay, but itching bumps. That could be a million things, couldn't it?
Yeah.
Allergies, fleas.
Exactly. Those are very general signs. So yeah, you definitely have to think about other possibilities too.
So what are some of the, let's say, more specific or visually striking things that might point more towards a drug reaction?
Okay, yeah. This is where it gets more specific. One really noticeable one is called exfoliative erythroderma.
Okay. Sounds intense.
It looks intense, too. Imagine just widespread redness all over the skin, almost like a bad sunburn because the blood vessels dilate. And then it often leads to, like, major scaling or flaking of the skin.
Wow.
And what's really key here, this one's often linked to topical things, shampoos, flea dips, even some ear meds.
Stuff you put on the skin or in the ears?
Precisely. So you'd want to pay close attention to the ear canals, the inside of the ear flap, if you're using those kinds of products.
That makes total sense. Direct contact.
Yeah.
Okay, what if you see sudden swelling? Like poof.
Right. That could be urticaria. We usually call that hives, or angioedema. That's a deeper swelling down in the tissue.
Hives and deeper swelling. Okay.
And these are typically what we call a type hypersensitivity reaction. Basically, the immune system overreacting like really fast to something it thinks is a threat.
Even if it isn't really harmful.
Exactly. But the important thing here, this usually means the pet has been exposed to that drug before.
Okay, so it's not the very first time they get it, usually.
Generally not for this type I reaction. The immune system needs that memory, that prior encounter, to launch that quick response. It's like an allergy developing.
Gotcha. Developing over time. Makes sense. What else?
Then there's something called hypersensitivity vasculitis.
Vasculitis. Inflammation of blood vessels.
Exactly. The small blood vessels in the skin get inflamed. Think of it like pinching a garden hose. The inflammation restricts blood flow, oxygen, nutrients.
Which could damage the skin tissue itself.
Right. This one's often thought to be a type 3 hypersensitivity reaction. Different mechanism.
Okay, that sounds pretty serious too. Are there other visual things to watch for?
Yeah, we can also see something called eosinophilic dermatitis with edema. In dogs, sometimes it's called Wells-like syndrome.
Wells-like syndrome, okay.
This looks like really deep red patches or raised plaques. Sometimes they can even look a bit like targets, like a bullseye.
Target lesions. Interesting.
And what's really fascinating with this one is a potential link to like sudden tummy troubles, acute GI upset.
Really? The skin reaction is linked to stomach issues?
Potentially, yeah. And specifically to some meds used for those issues, like antidiarrheals or things to stop vomiting.
Huh. So if your pet has gut problems, gets meds, and then gets weird skin spots, tell the vet everything they took.
Absolutely. That connection's important.
And you mentioned target lesions. We hear about those in people too, don't we?
We do. Those are sort of the classic sign for erythema multiforme, or EM.
EM, okay.
You see these reddish spots. They might spread outwards, maybe clear up a bit in the middle, giving that target look. But honestly, EM lesions can actually show up in all sorts of shapes, not always perfect targets.
Right. And then there are the really, really severe ones I've read about. Stevens-Johnson syndrome, toxic epidermal necrolysis.
Yes, SJS and 10N, those are definitely at the extreme end. Very serious.
What's the main difference between them?
It's mostly about how much skin is affected. Specifically, how much of the top layer, the epidermis, is detaching, like peeling off.
Okay.
If it's less than, say, 30% of the body surface, we generally call it SJS. If it's more widespread, over 30%, that's 10N.
30%. Wow.
Yeah. And with SJS, you often see the mouth involved too, the lining inside. With 10, the skin surface gets really moist, raw, super inflamed, huge risk of complications.
That sounds incredibly dangerous, like a burn victim.
It's very similar in terms of the risks and the need for intensive care. Immediate vet attention is absolutely critical. Time is everything.
Definitely.
Okay.
Any others?
One more category, though less common, is drug-induced pemphigus or pemphigoid.
Pemphigus.
Yeah.
That's autoimmune, right? Body attacking itself.
Normally, yes. And that's the tricky part. These drug-induced forms can look exactly like the spontaneous autoimmune versions.
Oh, great. So how do you tell?
It's tough, and sometimes, even after you stop the drug you suspect, the symptoms might, hang around for a while.
Oh, really? They don't just stop?
Not always immediately. There is a known link, for example, between a topical product called Promeris, specifically the ingredient metaflumazone, and pemphigus foliaceus developing in some dogs after they used it.
Right. I remember hearing about that product being discontinued. Okay, wow. So that's a huge range of reactions, mild itching all the way to, well, TENSERD. Let's dig into the causes a bit more. Is it always like a typical allergy?
Not always, no. I mean, some clearly involve hypersensitivity, like those type A reactions, the hives and swelling, and probably the type 3 and vasculitis. But honestly, for a lot of these drug eruptions, the exact how and why at the cellular level, it's still not perfectly understood.
Huh. Hey.
But what we do know is that basically any drug, any type of medication could potentially be a trigger. It's not just antibiotics or, one specific class.
Any drug at all.
Pretty much anything is possible. And like we touched on, it can happen with the very first dose someone gives.
Or after they've been on it for ages with no issues.
Exactly. Weeks, months, even years sometimes. Then suddenly, bang, a reaction, which, makes it hard because you might not immediately think, oh, it's that pill they started 6 weeks ago.
Yeah, that's a bit scary, actually. You wouldn't connect the dots easily.
It can be tricky.
Okay, we mentioned some links already, topicals and that foliative thing, GI meds, and the eosinophilic dermatitis.
And the metaflumazone and pemphigus, yeah.
Are there other known risk factors? Like, are certain breeds more prone or ages?
For the most part, we don't really know. There aren't clear age, breed, or sex connections for most drug eruptions. It seems pretty random.
Really? No patterns?
Well, there are a few exceptions. Like, there have been reports of whole litters of puppies having reactions to the rabies vaccine, suggesting maybe some family or genetic link in specific cases like that.
Interesting. Like a familial thing.
Possibly, but generally, predicting which individual animal might react, yeah, that's still a big challenge for vets.
Okay, so it's hard to predict. Let's say we do suspect a reaction. Our pet has weird skin stuff after a new med. What's the diagnostic process? How do vets figure out if it is the drug and not something else?
Right, that's super important because, like you said earlier, itching and rashes can be so many things, so the first step is always ruling out the other common culprits.
Makes sense. What kind of things?
For that general itchiness and those non-specific rashes, we're thinking allergies like atopy, which is kind of like pet hay fever, or food reactions, maybe contact allergies from something they touch, and parasites, of course. Flea bites are a huge one, scabies mites, even reactions to bug stings sometimes.
Right. Rule out the usual suspects first.
Yeah.
What about for those more specific-looking reactions, like that widespread redness and scaling one?
Exfoliative erythroderma, yeah, especially if it's an older pet, we'd need to consider something more serious, like epitheliotropic lymphoma. That's a type of skin cancer that can look quite similar.
Okay, good to know. And vasculitis, that inflamed blood vessel thing.
With vasculitis, usually a skin biopsy confirms that part, but then the work starts to figure out why. We need to rule out infections, different cancers, other autoimmune diseases.
So it could be caused by other things, too.
Oh, yeah. And frustratingly, a lot of vasculitis cases end up being idiopathic.
Meaning you never find the cause.
Exactly. We just can't pinpoint a specific trigger. But depending on the case, vets might run tests. For dogs, maybe check for tick-borne diseases like rickettsial ones. For cats, maybe tests for FIV, FeLV, FIP, or bacterial and fungal cultures if the information looks a certain way.
Okay, so a lot of potential detective work. What about for the really bad ones? EM, SJS, TNA?
Yeah, for those severe ones, the list of rule-outs includes infections elsewhere in the body, like respiratory infections, certain viruses like herpes or parvo, bacterial infections.
Infections not on the skin causing skin reactions.
Correct. Also, internal cancers sometimes. And just to complicate things, there's a chronic form of EM in older dogs that just happens. Idiopathic again. Cause unknown.
Man, idiopathic seems to pop up a lot.
It does in dermatology, unfortunately.
And what about those fixed pemphigoid ones that mimic the autoimmune type?
Well, while we always consider a drug reaction if the timing fits, it's important for people to know that the spontaneous autoimmune forms are actually way more common in pets.
So the drug cause is possible, but maybe less likely than the body just doing it on its own?
Statistically, yes. So it's all part of that careful evaluation process.
Okay, so besides looking at the skin and considering other diseases, are there other tests, like blood work?
Oh, absolutely. Basic blood tests, a CBC, a chemistry panel, checking the urine, those are really helpful. They tell us if other organs are involved, which can happen, especially with things like vasculitis.
Gives you the bigger picture.
Exactly. And like we said, specific blood tests can help rule in or out certain infections depending on what the vet suspects.
But it really sounds like there's one test that's kind of the gold standard for nailing down most of these skin diagnoses.
You're spot on. For most of these conditions, we're talking about vasculitis, EM, TN, eosinophilic dermatitis, pemphigus, a skin biopsy is crucial.
Taking a little sample of the skin.
Right, and sending it off for histopathology, that's where they look at the tissue under the microscope. It gives us so much detail about what's actually happening at the cellular level. It's often essential for getting a definitive diagnosis.
Okay, biopsy is key.
Mm.
So let's say the diagnosis points strongly towards a drug reaction. What's step one for treatment? Like the absolute first thing?
Stop the drug immediately. That's number one, non-negotiable. Discontinue whatever medication is suspected.
Makes sense. Get rid of the trigger.
Yep. Now, for those really severe ones, SJS and TAN, those pets often need intensive care, hospitalization.
Because their skin is so damaged.
Exactly. They lose a lot of fluid and protein through that damaged skin, so managing their hydration and nutrition is critical. And the risk of secondary infection is massive. So preventing and treating infection is a huge focus. It's very much like managing a severe burn patient.
Right, you said that. It requires intensive support.
Absolutely. And
Wow.
again, for severe blistering, widespread peeling, get to a vet immediately. Time is critical.
Okay. What about pain? These conditions sound painful.
They certainly can be. So pain relief is important, yes. But we have to be really careful.
Painful why?
Because we're already dealing with a suspected drug reaction. The last thing we want to do is give another drug that could potentially make things worse or cause its own reaction. So pain management needs very careful consideration.
Right. Don't want to add fuel to the fire. What about drugs to actually stop the reaction itself? Like calm the immune system down?
Sometimes, yes. For that chronic idiopathic EM we mentioned, drugs that suppress the immune system, things like azathioprine or cyclosporine, can work well.
Okay.
For other drug eruptions, if just stopping the offending drug isn't enough and things aren't improving, then yeah, immunosuppressive therapy might be considered. But it's a bit controversial for SJS and a TN.
Why is that?
Because those patients are already at such high risk of sepsis, of overwhelming infection. Suppressing their immune system further could be really dangerous. So it's a tough call, weighing the potential benefits against those very real risks.
Okay, tricky balance. And then looking ahead, how do you prevent it from happening again?
Avoid the drug. That's the absolute main thing. Avoid the drug that caused the problem, and crucially, avoid any other drugs in the same class or family because they might cross-react.
So make sure it's flagged in their record.
Absolutely critical. Big red letters, highlighted, whatever it takes, so that drug or related ones are never accidentally given again.
And when treatment starts, what kind of follow-up is needed?
It really depends on how sick the pet is. If they're really debilitated dealing with SJS or 10NN, they'll likely need to be hospitalized for that intensive supportive care and constant monitoring.
Round-the-clock care.
Yeah. For less severe cases, maybe outpatient management is okay, but with, frequent rechecks with the vet to make sure they're heading in the right direction.
Okay, so thinking longer term then.
Yeah.
If a pet gets through one of these reactions, what are some considerations? What's the prognosis usually like?
Well, one thing to keep in mind is that some of these reactions can almost kickstart an ongoing immune response. It doesn't always just switch off when the drug is gone.
Oh, really? It can keep going.
It seems that way sometimes. Plus, the drug itself or the metabolites, the stuff the body breaks it down into, can actually hang around in the system for days, even weeks sometimes.
Still causing trouble even after you stop giving the pill.
Potentially, yeah. Which might explain why the reaction doesn't always resolve instantly.
That makes sense. And prognosis-wise?
It varies a lot. For 10, that really widespread skin loss 1. Honestly, the prognosis is often pretty guarded, even poor. The risk of fatal complications is high.
Yeah, that sounds incredibly tough.
Vasculitis also carries a guarded prognosis, especially if it starts affecting internal organs, not just the skin.
Systemic complications.
Right. And with any of the severe forms, like SJS and tenon, we're always worried about those secondary infections, electrolyte problems, protein loss. They can be life-threatening issues on their own.
So it can definitely be very serious with potentially long-lasting effects or tough outcomes.
It certainly can be, which really circles back to why catching any weird skin changes after medication and getting vet help quickly is just so important.
Absolutely. Okay, so just to kind of wrap up our deep dive here, the big picture is that these cutaneous drug eruptions in pets are, well, complicated, super varied in how they look, what might be going on underneath, and how severe they get.
Right. And the main message for you listening as a pet owner is really this. If you see anything unusual with your pet's skin after any kind of medication pills, liquids, topicals, eardrops, injectables, anything,
Anything at all.
get it checked out by your vet. Don't wait and see. Prompt attention is key.
And when you go, be ready to list everything. Every single medication, supplement, flea treatment, shampoo,
Yeah.
everything they've had recently.
That detailed history is just invaluable for the vet trying to piece things together. It really helps.
Definitely. So maybe a final thought for everyone listening to chew on.
Yeah.
Given this huge range of reactions, and this idea that sometimes the immune system can kind of keep reacting even after the drug is gone, what does that mean for how we think about long-term medication use in our pets and how closely we need to monitor them?
That's a really good question, something to definitely keep in the back of your mind, isn't it? As a responsible owner navigating your pet's healthcare?
Absolutely.
Yeah.
Because ultimately, understanding these potential issues, even the scary ones, just makes you a better, more informed advocate for your pet's health.
Couldn't agree more. Knowledge is power, right?
Yep.